Welcome to another HER Health Collective Roundtable, where we bring together experts from our provider directory to dive into topics that truly matter to moms. We host 4 of these roundtables each year, and they've become sort of our most popular episodes. I think because we have so many amazing women on here that people just love listening to these podcast episodes. Each expert here brings a unique background and specialty, offering distinct perspectives on the topics we explore. These roundtables also foster collaboration among professionals from different fields, helping us to build a more holistic model of care for moms. By joining forces, our experts expand their referral networks and underscore the importance of a collaborative approach to maternal health. Today's roundtable focuses on views of an expert, a mother's main worries, and how to tackle them. We're thrilled to be joined by several HER experts from our online provider directory. The provider directory is a free public resource offering a carefully vetted selection of top professionals across the fields that support mothers. So be sure to go in and check out this directory for the highest quality providers in our community. Before we get started, let's hear from each of our experts as they introduce themselves and their areas of expertise. And this will also give you, the listener, a chance to hear their voice so that you'll know who's speaking throughout the discussion today. So we'll get started. I'm looking straight into the eyes of Dr. Henry. I know everyone's on the edge of your seat. Who's she calling first? And so, Dr. Henry, you're it. Good to see you.
Hello, I'm happy to be here.
Could you give us a little introduction on what you do and say a little bit more so that people can hear your voice and connect it with your profession?
Absolutely. My name is Bong Henry. I am a physical therapist specializing in orthopedics. So that's your regular bones, muscle problems, as well as the pelvic floor. I have 15 years of experience helping adults in a variety of settings. And my private practice is Radiance Physical Therapy in Durham. I offer integrative pelvic health and women's health coaching services, helping women and men and people of all genders through the lifespan, mainly adults, so teens and above. Usually people see me for if they're having pain with using a tampon, pain with sex. They may be an athlete trying to prepare for birth. And quite honestly, even if you don't consider yourself an athlete, preparing for birth is a very vigorous event on your body. And so is caring for small children. So working together with my clients, I collaborate them to get to a full level of recovery so that they continue to be able to take care of themselves through the decades and beyond. And I'm also a women's health coach. So I'm able to help women who are wanting to trade exhaustion and burnout for finding vigor and calm as they are navigating the challenges of being a working parent and also caring for your own parents.
Wonderful. Thank you so much, Bong. It's great to have you here, and you're going to have great insights, I'm sure. Erin.
Hi, everybody. My name is Erin Jones. I'm a therapist. I'm a licensed counselor. I work at really great group practice called Bull City Anxiety and OCD Treatment Center, actually located in Chapel Hill, despite the Bull City name. I specialize in working with kids, teens, and adults with OCD, anxiety, or anything related to it. I'm especially passionate about working with parents and moms. I have some lived experience myself, and I'm pretty involved in the International OCD Foundation and just have so much love for that community.
Thanks so much, Erin. So glad you're here. Chasta.
Good morning, everyone. Thank you so much for having me. I am the founder and CEO of Stage Door Dance Productions in Raleigh, North Carolina, as well as the founder and president of Girls Geared for Greatness, which is a nonprofit. I am also a speaker, an author. I have 3 books. One is called Trash the Trophies, which is about our decision to extract our studios from competitive dance to focus on a more healthy and holistic competitive at life experience. The other is Handle the Horrible, which is all about how art is an opportunity for catharsis and resilience and adaptability in both children and adults. And then a children's book called The Trophy Trap, which complements Trash the Trophies, but for all youth activities because of the presence of toxic achievement culture. I love what I do. I'm also a mom to a 3-year-old, so I'm right in there in the trenches, not only professionally, but personally. And I admire what Cindy and Chrissy do so much and am excited to be a voice here this morning.
Thanks so much, Chasta. Actually, both Chrissy and my kiddos have used Chasta's programs, and we think very, very highly of what she does. So thank you so much, Chasta. Brooke, I didn't even get to say hi to you yet this morning. Hi, how are you?
Hi, I'm Dr. Brooke Orvis. I'm a board certified pelvic floor physical therapist and a women's health practitioner. I am residency trained in the pelvic floor. I've been practicing for about 7 years. And my private practice is called Flora Physical Therapy. It's located in Durham, North Carolina. I love working with everyone with a pelvic floor because everyone has one. So men, women, kids, the LGBTQIA plus community. So I'm really passionate about providing inclusive care. Really big about being kink positive, health at every size, trauma informed. All of the things are very important, and I feel like nothing is off the table when I'm working with folks because everyone poops, pees, and has sex. So we should talk about it if you're having issues. And I'm also a mother myself. So I have a 2.5-year-old toddler, and then I'm currently pregnant with our second.
What? Congratulations. She just dropped that on us. Nobody knew. That's amazing. Congratulations. Dr. Hidalgo.
Thank you for having me. Well, I am Dr. Priscilla Hidalgo. I am a psychiatrist. I have a passion for women's mental health and physician wellness, and that's usually what my practice focuses on. Even though my office is located in Raleigh, I see patients all over North Carolina and also Florida. I primarily focus on medication management and psychotherapy, but anything related to women's health, a huge buff for that. Another thing that I'm really interested in is just make sure that women and other patients can have easy access to a psychiatrist. So I made it very easy for people to get booked for an appointment with me. They can just go to my website, lookpsychiatry.com, fill out the form, and then they have access to my schedule so they can book when it's most convenient for them. So they don't have to wait until I call back, because God knows when that will happen. So I just want to make sure that I am available to help people.
That's wonderful. Busy lives, right?
Yes.
Thanks so much. Kristen.
I'm still laughing about Dr. Hidalgo's because I'm like, yes, thank God for calendars that can book themselves. Thanks for having me. I'm excited to be here with you all. What a great group of people. I am Kristen Baker. I am the founder of KB Coaching and also Lumo, a co-founder of Lumo. KB Coaching is my business, my private executive coaching business that I've been running for about 9 years here in Durham, North Carolina, where I specialize in taking care of working moms who struggle to prioritize and reconnect with themselves. And I'm all about moms getting to have a lot more fun, because I was once a mom that was having no fun and I was really mad about it. So, coaching saved me, and that's why I do what I do. I also have a business called Lumo, which is short for Luscious Mother. Don't tell anybody, that never would get through the corporate filters. But that's why we changed the name. But that's more leadership development, partnering with companies to support working parents so that moms aren't doing that out of their wallet. That's our sneaky way of really like transforming the workplace culture to make it more inclusive and more supportive of parenting when we are on a 7:15 to 2:15 schedule. I mean, that's my kids' schedule. I work from 9 to 5, so we try to do things to make that easier on parents and really be an advocate for parents in every way that we can.
Super. Thank you so much. Glad to have you here. Dr. Hutchinson.
Hi, good morning. Thanks for having me.
Yes.
I'm Dr. Catherine Hutchinson, and I am a clinical psychologist. I am one of the senior clinicians at Peak City Psychology in Apex, North Carolina. And I have always specialized in parenting stress, and particularly in mothers. And I see moms all the way from sort of the perinatal, postpartum period, all the way up through childhood into the transition to college and into even parenting adult children. So that is what I do. And I'm also a mom myself. My kids are a little older. They are 17 and 20.
Thank you so much, all of you, for being here with us today for what I think is going to be a very well-received conversation. I know we're going to dive into a lot of different topics. So we're talking about worries and anxieties. And I feel like before we can talk about a mother having worries and anxieties within her motherhood realm, we always have to throw out that disclaimer that there's a lot of joy and laughter and love in motherhood. So I'm throwing out that disclaimer. Okay. So along with the joy, laughter, and love of motherhood, it often comes with worries. With worry and anxiety, there are several layers to explore, especially when we distinguish between what is a typical worry and what might be a more serious mental health concern, such as anxiety disorders or OCD. In our community of moms, we talk to so many, and there are a lot of us that personally are navigating things like anxiety or OCD. And then we also have children that are navigating these conditions. Erin, I'm going to start off with you. As usual, anybody else can hop in on any of these questions, but we are going to initially direct it at someone. Erin, can you talk about the difference between normal worries and rumination and what signs to look out for when it could be turning into something a little more serious like anxiety disorders or OCD?
Yeah, absolutely. So yeah, common question for all of us as parents, especially me, is this normal? I know that can be really hard to answer. I think in terms of worrying is a human feeling. We all worry, our kids worry. Worrying does have some sort of function to us, right? It helps us protect ourselves from an evolutionary perspective. So to some degree, yes, worry is a normal emotion. I would say normal or typical worrying tends to be in proportion to what's going on. So what I mean by that is if, maybe your kid is starting to show symptoms of an illness, or, I'm experiencing something concerning in my body. There's a storm outside. I might start to have some worries. But I think in terms of unhelpful rumination or excessive worrying, that tends to be more time-based. So now instead of having a worry, are we worrying? Are we thinking and thinking and thinking without really coming to any conclusions or helpful thoughts? Is the worrying starting to, or the things that we do to try to resolve those worries, like checking things or asking other people questions or researching, checking on our kids excessively, are those things starting to impact our lives? So, okay, am I having a hard time focusing, being present with my children? Am I maybe having a hard time sleeping, eating, focusing at work? So it can definitely be a slow burn and hard to spot initially, because a lot of worrying can, again, seem very helpful and like problem solving, but rumination really just continues on and doesn't really get us anywhere. So I think, again, where something is turning into more of an anxiety disorder or maybe even OCD, obsessive compulsive disorder, the worries or the things that we are doing to try to neutralize them are getting in the way of our lives.
Thank you so much for that, Erin. You had briefly touched on this sort of threshold. It's not always easy to spot, but there's this threshold where it kind of veers over into an actual medically diagnosable condition. Dr. Hidalgo, how can we manage anxiety once it crosses that threshold? And what role do strategies like self-compassion and cognitive restructuring play in this?
Yeah, and as Erin was saying, because Erin explained it beautifully, worry is normal. I mean, we all need to worry. And my mom used to say, don't tell me not to worry, because like telling water not to be wet. I'm a mom. I will always worry. Doesn't matter how old you guys are. So I will always be the person worrying. I think that the first thing that we need to identify is whether or not we're dealing with an actual anxiety disorder. The person might have a difficult time discerning that, because sometimes it gets to a point that people have been anxious for so long that it becomes a way of living. So they don't know what it's like without worrying. Or for instance, they have functional anxiety where they say, you know, but I still work, I still take care of my family, everything is fine. How can I still be anxious? Another group of patients, you know, these are the patients that have tried everything, you know, long baths, they have tried yoga, they have tried to be kind to themselves. And they're like, you know, I'm still struggling with all these things. And I think this is where it comes helpful, one, to have people around you that can tell you, hey, I think this might be a little bit of overreaction in terms of how much you're worrying about the situation, let's say. But also maybe you need to see a psychiatrist or you need to see a therapist so you can have a proper evaluation and have a discussion about how you can manage the anxiety. Depending on the severity of the anxiety, we might be talking about managing only with psychotherapy, managing with medications, or both. There are some people that are severely anxious that they're not able to derive benefits from therapy because they are so anxious. So then the first step would be to consider taking medications so that way they can continue to work in therapy and learn skills on how to manage the anxiety. One of the things I always explain to patients is that anxiety, if you already have an anxiety disorder, anxiety is not going to be something that you will no longer deal with once it gets treated. It is always there. Life happens when you are in treatment, and you might have the skills to deal with anxiety in a specific situation, but then now you might be facing something different that now requires a different set of skills. So I always tell patients medications cannot happen without ongoing psychotherapy. It just doesn't work out. Self-compassion, I think, is huge, is very important, because I think women naturally feel the burden of taking care of the whole family and everything usually falls on them. I think also society has kind of glorified the role of a woman that, oh, you're supposed to take care of your family, you're supposed to look great, be happy while you're doing all that, and you're sleep deprived and you probably haven't had a chance to eat all day, but you're supposed to be happy and excited. And also you're supposed to then have a partner that you can feel sexy with. I mean, I think it's a lot of expectations for a woman. And I think that when we feel that we're not meeting those expectations, then we're like, I don't think I'm doing enough. And then we try to figure out ways to manage that. A lot of people think that if you're kind to yourself, then you're going to become complacent. But that actually never happens. I always tell them, if you had an animal that you had to, you know, move, you can keep on beating the animal, but the animal is not going to move any faster. But if you're kinder to the animal might start moving. It's kind of the same thing in terms of the way that we think. The kinder that we are to ourselves and that we acknowledge, okay, I'm struggling right now, and you know, and we cut ourselves some slack, the easier it is to deal with anxiety and all the other challenges that come with motherhood.
So many important points there, Dr. Hidalgo. Thank you very much. I'm going to shift over to Kristen now. Kristen, one of the many causes of excess worry in motherhood is due to increasing feelings of despair and resentment, whether it's within the relationship at home or a lack of help or any number you pick out of a hat, any number of situations in the world. Will you please talk about these two emotions and what they may be attributed to?
Of course. Well, first of all, as a parent of a daughter with OCD, I'm loving this conversation. Thank you very much for your expertise. And I want to just caveat the question about despair and resentment with that. I am a coach, and coaches work from where we are today into your designed future, and therapists are who we partner with when we discover something with a potential with a client and that it's something that needs healing work. That is not my area of expertise. So I can speak to how I look at these through a coaching lens, but if there's healing work necessary, I'm never going to step into that area because that's I'm not certified for that. However, there's so many factors that can go into a person's feeling of despair or resentment. And so I can speak to it generally, but oftentimes despair is related to a real lack of well-being, like unmet needs over a really long time. Same with resentment, but that one is more interpersonal. So because moms are my favorite people to talk to, and because that's my area of expertise, it's because it's my human lived experience, and struggling with resentment myself so much when my daughter was young. She was almost 2 when I started training to become a coach and started being coached myself. And I was so irritable, so resentful. And that's because I had no idea how to ask for help. I had no idea that I actually had needs and that they mattered and that I needed to do something about them. The way that I immaturely faced it is I kind of expected other people to like figure out what my needs were and then maybe meet them for me, but I was not responsible for them. And that's just because I didn't know any better. So over time, as I learned about my personal needs and how to meet them, which is a real process, which is a learning process, which so far has not stopped, which I'm continuing to learn daily. It's great. But that process has made it so that now when I sense resentment inside of my relationship, for example, with my husband, I'll use that example because it's the one I see the most. That is for me to take a look at because I have overextended somewhere and or not asked for help somewhere and or not like that's my boundary. As soon as I notice resentment, I'm like, uh-oh, mama has gone off the rails and I got to take a look at what I'm not handling. And despair is, they're kissing cousins. There's different aspects of both of these emotions, but when you have unmet needs for a really, really long time, which is for whatever reason, whether you have lots of kids or a real dearth of support, or because, financially you're struggling, there's so many different aspects to well-being, which we tend to think about as only physical, but like your soul needs things too. And that may be, via religion, or it could be a spiritual thing. It does not matter. It's not, like that, but lifestyle, like are your finances okay? Is your relationship, like your main relationships okay? So I rarely work with people who are in despair because that's more therapeutic, but I help them on their way out. And that is when we start looking at all the different places that they might need something and how we can begin to get those needs met.
This is Dr. Hutchinson. I agree. It's particularly that resentment issue. I see it a lot, especially in like cis hetero couples. There's a lot of resentment. And I think this is a place where it's really important to acknowledge all of sort of the invisible labor and mental labor that women tend to take on in relationships. And I think that's a place where there's a lot of work to be done, and recognizing for yourself as a mom all the things that you're carrying, and even to write it down as a list so that you can appreciate and acknowledge all that you're doing. And then once you're aware of that, you can start to sort of assess, do I want to carry all of this? Is there something I can ask of my partner? Is there a way that we can divide this that feels more equitable? I think one really good practical tool for this is the book Fair Play by Eve Rodsky. She has a book and a card deck, and it's just a really practical tool that I recommend for a lot of families that helps you sort of rebalance some of that invisible labor and the tasks involved in raising kids and managing a house and a life together.
That's a great book. I read it, and it's amazing once you investigate all of these invisible things that are done. Everyone has duties, and we don't even realize that we're doing them and picking up on these different invisible tasks. So thanks for that recommendation and for your input in there. And you had mentioned the word carrying, and I know that you weren't referring to it in a physical sense. It was more like hypothetical, but I'm actually going to move us into the actual physical demands of parenthood and caring for children, such as the constant energy that it requires. A mom has to have resilience and flexibility. I don't know if anyone else is like me. I have a 12 and 14-year-old, and they still hang on me, and they still, Mom, pick me up. This was yesterday with my 12-year-old. So good thing I lift weights. There's a lot of different things that need to happen with your physical energy in order to handle the daily tasks of raising children. And there are different specific challenges that make maintaining that stamina difficult over time. So Dr. Brooke, I'm going to direct this question to you. Again, anyone else can chime in as well. You've worked with moms on issues like pain during sex and prolapse, as well as leaking during exercise or just physical movement. How do these impact a person's ability to be present for their kiddos, and what can be done to treat them?
Yeah, this is a really great question, and it's something that I see a lot with birthing people in my private practice, and unfortunately is something that I have experienced myself as a mother, which when you go through it, it's incredibly like distressing. Like you want to be physically and mentally present with your family, with your children. And when you can't even pick up your baby because you pick them up and you have leaking of urine, or you feel like something is coming out of your vagina, it's like, what the heck is going on? And then obviously adding in, just the different layers with pelvic pain and pain with intimacy. I feel like a lot of clients that I work with, they feel like they come into the clinic and they're like I'm broken, like something is wrong with me. I don't recognize my body. And I feel like a lot of times, not only are folks dealing with the mental aspect of things, but they're also processing the very real physical changes that they've gone through during pregnancy and after delivery. And I just find for a lot of people, it can be a really difficult time. And I feel like it impacts so many layers. I have a lot of people that aren't able to jump on a trampoline with their children, or they don't want to exercise or run, because I feel like there's a lot of fear mongering within the medical and health communities for what birthing people's abilities are after they have children, and don't do this and don't do that. And I feel like it all can just be incredibly confusing. So I am really passionate about empowering my clients and telling them your body is capable of way more than you probably think that it is, or maybe what your provider told you it's capable of doing. Specifically with like pain during sex, with pelvic organ prolapse, a lot of times assessing the tissues so we can actually get an idea of like what's actually going on. I feel like it's really important because a lot of times people think that it might be an issue with like weakness in their muscles, and it might actually be tension. And I feel like a lot of times Kegels are kind of like the like Band-Aid, glaze over everything, just do Kegels and it'll be better. And I'm like, that's actually like not appropriate for a lot of birthing people, especially those that are having pelvic pain or pain during sex and intimacy. So I think not only just like assessing the tissues and getting a formal assessment, but working with a provider who is actually taking your goals into consideration. I worked with a client when I first started practicing, and she was coming to see me for pelvic pain, but she was also having leaking with exercise. And I was so fixated on the leaking. And she's like, Brooke, I literally don't care about that. I just want to resolve the pain during sex. So that was like just kind of a pivotal moment for me to be like, okay, like I need to be better about asking my clients what they actually want to focus on. So I think that's really important too, is figuring out like what you're struggling with, and like what do you want to focus on during that like post-delivery season, and making sure that you're working with a clinician that is going to center the care that you're receiving around those goals that you have for yourself.
Wonderful. Thanks so much, Brooke. Dr. Bong, can you expand on how to balance our own physical health and wellness goals while maintaining the daily demands of parenting? This is hard.
Yes, it is hard. And so I'm a parent of 3 kids, and they range from ages 10 to 3. So I get it. I get that it's a challenge. And I'll say the biggest thing that I've noticed is time is a barrier for anybody. But, even teenagers, they're strapped for time. If you don't have kids, you're strapped for time. Like, it's a human problem, quote unquote, that we are busy people. And I think the biggest thing when we're looking at like a mother's worries and being able to take care of your own body is recognizing that it doesn't have to be all or none. Pregnancy is a beautiful time to be able to, start kind of reimagining what your future looks like. Quite often I see a lot of, busy women, and they recognize like, wow, I can actually slow down a little bit. My body is telling me to slow down. And we also strategize on what this means for your healing process. And what you do at 6 weeks for your recovery should be really different than what you're doing at 6 months postpartum and 6 years postpartum. So being a parent, there's a spectrum of what changes, but time is always a challenge for everybody. And personally, I enjoy sports. I've been able to do half marathons after my children were born. So 2 after my first was born, one after my second and one after the third. And quite often people are like, I can't imagine doing that. But the truth is, it starts with your imagination. It starts with believing that you deserve support. We've talked, the experts talked about that earlier, that parenthood is not meant to be alone. And it is a bit of a farce to think that you can care for a newborn, get 10 hours of sleep, keep your kitchen clean for your in-laws and your grandma who wants to come visit, and be back at work at 3 weeks postpartum, fitting into your old pants. So recognizing when we kind of peel back some of the facades of society and then look at one starting with like healing from birth, because that for some people doesn't happen until they actually take steps to go see a pelvic floor physical therapist or OT. And then two, recognizing it doesn't need to be all or none.
So important, and such an important message in so many aspects of motherhood. Thank you very much for that, Dr. Brooke and Dr. Bong. Thank you to each of our expert panelists for joining us today and sharing your insights on a mom's primary worries and how to address them. We are so grateful for the time and the unique perspectives each of you brought to this conversation. For more valuable content from our experts, be sure to visit herhealthcollective.com throughout the year. We have new content coming out every week.
Thank you so much, everyone. It was delightful to spend time with you.